point.
Okay.
You're live, Susanna.
Hi, everyone. Thank you for taking the time to be with us this afternoon for this virtual town hall that we hope you will find instructive and helpful during this time. I'm Susanna Lewis, Community Relations and Clinical Outreach Manager at Silver Hill, and I'm here with Dr. Andrew Gerber, Silver Hill's President and Medical Director, and Dr. Stephen Zanakis, who is leading Silver Hill's COVID Resilience Team, which is the hospital's newly launched initiative to support the mental health and resilience of frontline workers during this time. Over the next 45 minutes or so, both doctors will respond to a series of prepared questions, and then we'll leave time at the end for any of you who is attending who would like to ask something of them. So before we jump into those questions, I just want to share a little bit more about Dr. Gerber's and Dr. Zanakis's backgrounds with you. Dr. Gerber is a child and adolescent psychiatrist whose career combines his work as a clinician, scholar, and research scientist and executive. He completed his medical and psychiatric training at Harvard Medical School, Cambridge Hospital, and Weill Cornell and Columbia Medical Schools. He completed his Ph.D. in psychology at the Anna Freud Center and University College London. Prior to joining Silver Hill, Dr. Gerber was medical director and CEO of the Austin Riggs Center in Stockbridge, Massachusetts. Among his many affiliations, he served as associate clinical professor in the Division of Child and Adolescent Psychiatry at Columbia University Medical Center, and as an associate clinical professor at the Yale University Child Study Center. We're privileged now to have him leading the work we do here at Silver Hill. Dr. Zanakis likewise trained as a child and adolescent psychiatrist, and his career comprises many years of clinical, academic, and management experience. He retired from the U.S. Army at the rank of Brigadier General after more than 30 years of service supporting and training soldiers and their families for crisis situations. He has advised the chairman of the Joint Chiefs of Staff and other Department of Defense officials on psychological health, and we are likewise very privileged to have him here leading our COVID resilience team at Silver Hill. So the first question that I'd like to pose to both doctors is just sort of or not so much a question, but a request, if you could give background about what the work of the COVID resilience team is and how it came into being during this time.
Terrific. Well, thank you so much, Susanna. And it's really a privilege to be here. And I'm grateful to the work that both you and Kristen Wolf, our Director of Business Development, have done to develop this event today. And it's an honor, as always, to be on the same stage with General Zanakis, who is a good friend and colleague. I do want to remind us to kind of reintroduce ourselves periodically, because I know from having done several of these virtual town events that people do join a little bit later on. So if you were on time enough to start right at the beginning, you'll get to hear the full intro. But if you join a little bit later, it's a little bit like joining a TV broadcast where they remind you who's speaking. So I'm Dr. Gerber. I'm the President Medical Director at Silver Hill. And you know, I wanted to start off by giving just a little bit of the history of how we got here today with this COVID resilience campaign or COVID resilience team that Dr. Zanakis is leading, because you know, the last several weeks or even few months now, I imagine for many of you, like for me, is a bit of a blur. And I find it helpful to go back a little bit and say that right as all this was starting over 2 months ago, we had some general sense of the scope of what was coming in terms of the virus. But at the time, not a lot was being said about the mental health implications. And those of us who work in the field, and I would describe myself as somebody who has seen the mental health implications of a range of stressors, but had not previously worked specifically in caring for individuals who were responding to essentially disasters, which is what we've got right now. I knew enough to say, we need to bring in the experts. That is, this is not business as usual. This is not the sort of thing that one can do one's psychotherapy or medication or even psychiatric hospitalization or residential services, all of which was sort of the standard system. We couldn't just turn to those systems and say, do what you usually do, because we were facing a world that was fundamentally different, one in which we were going to be stressed as a population, not just frontline healthcare workers, although certainly they were getting the brunt of things, but as a population, we were going to be stressed over the coming weeks, months, and even years. And I was grateful in that moment to have a pre-existing relationship with Dr. Xenakis, where I knew from our previous conversations that this is something, thankfully, that our military, in particular our military psychiatrists and health providers, have been thinking about for many years and really been planning for in other settings. And so very early on, Dr. Xenakis and I got on the phone and started talking about what was known about the way disasters impact a society and the different members of it, and what one could do. And right away, he talked to me about the need for something very clear and practical, that although academic knowledge of the consequences of a pandemic or a disaster are incredibly important and in a starting point in many ways, that you quickly had to turn ideas into action. And that action in many cases needed to be from the bottom up on the front lines. And so our conversations quickly evolved into, how do we build the infrastructure for that kind of work? So rather than talk about it, I want to now turn it over to Dr. Xenakis, who can start to tell you some more of the details of what he envisioned, and ultimately what we at Silver Hill and I could support in terms of such a plan. So over to you, Dr. Xenakis.
Well, thank you. And I want to, this is Steve Xenakis, I do want to recognize and acknowledge the tremendous leadership of Dr. Gerber and Kristen Wolf and Susanna Lewis, and also our new team member, Tara Reed. We're fortunate at Silver Hill to have such an energetic and thoughtful and committed group of people. We've got many people from the staff here who have really helped frame this, shape this initiative, and put it into action. And let's take off from really what has inspired it and where we're going. As I have to say that I'm feeling a little bit more emotional than I thought that I would, but we've just passed a Memorial Day. And after many years in the military, and I grew up in a military family, as I saw this pandemic come over the horizon, it did remind me of what had been the encounters, the experiences, and the friendships going back to the Vietnam War. I first came into the Army in 1970, and now through the Iraq-Afghanistan War, of how these kinds of crises really affect and bear down on the people on the front lines. In those wars, it's been our soldiers, also our healthcare people. We've had other crises and emergencies in this country. And now this particular pandemic, what it's going to do, how it's going to change the lives, particularly everyone's life has changed. We've lost 100,000 people in this country already. But how it's really going to change the lives of our people there on the front lines. And that's everyone. That's our police, that's our nurses' aides, our nursing homes, our folks in the emergency departments and the ICUs, everybody who is there and needs to keep all of our lives as healthy and sustain us every day as we can. And I think we were fortunate that Dr. Gerber and the staff here felt that down the core, and that we could then put together lessons learned from what we had seen in our military and through military mental health, and now reach out and touch the lives of our frontline folks and help them sustain themselves, be resilient, be as strong as they can be, and be as effective in what they're doing, and let them know that we really care down deep. And we care down deep because we were going to support them in every way possible. And that just wasn't going to be what we said, but we were going to do things. We were going to give them training. We were going to give them tools. We were going to give them the means so that they could continue to do what they needed to do, essentially to keep us all alive and healthy. And that's what our objective has been in putting this program together. And we're very lucky to have the talent and the energy of the folks at Silver Hill and in the community that we can now carry on with this mission. And so that's our opportunity to serve and to give back to those who have helped and serve us. So thanks for inviting me, and thanks for giving me the opportunity to be a part of it. So I turn it back to you, Susanna, Kristen, this conversation.
So a question for you, Steve, first off. Would you talk a little bit about the particular emotional and psychological vulnerabilities of those who are working on the front lines of the pandemic day to day?
Well, first of all, it's all consuming. I mean, particularly over the past couple of months, as we've had this surge or wave of patients. And most people that are on those front lines generally have the experience that they can't get away from it. They can't turn their brains off. And they're in situations that many times they've not had to face before, very sick patients. And they've seen patients die that otherwise in ways that they've not had to experience before. And it really is, it bothers them and upsets them to the core. And they don't even have the time or the space to be able to metabolize it. And so it's a profound stress with them. And unfortunately, too, that it's not clear what in the military we call them rules of engagement, but the rules aren't clear. This is really fuzzy. What are we supposed to do? This is a different illness. How are we supposed to treat these people? Are we doing everything that we can? They're just such deep questions that they have to face and do what they can. So this is a big stress, a huge stress on them. And I think we'll see that they'll be living with it and thinking about it for some time, even when it seems that it's sort of faded out of the awareness of most of the people in the public.
Suzanne, if I could jump in and just add to Dr. Snax's answer. One of the things that people who are in the healthcare professions, I think, will have some sense of, but those who are not, may not think about, is the degree to which we as healthcare professionals, particularly if you were trained recently in the last few decades, are used to knowing so much about what we were treating. In other words, the body of knowledge in medicine, in surgery, even in a field like psychiatry is so vast at this point, with the numbers of studies and the research that goes on, that we spend our time as trainees, whether medical students or residents, and even as doctors, dealing with things where the answers are generally known. And you may not know it yourself, but you can look it up in a textbook or look it up in a journal article or call a colleague at another. So to be dealing with a situation where so much is unknown, where there's so much uncertainty about the nature of the virus, about the way it spreads, about the degree of immunity that's conferred by exposure, the availability of tests, how accurate those tests are, that puts healthcare providers right away into unknown territory. And one of the things we know psychologically from the psychological literature, the psychiatric literature, is that human beings can cope with a lot of difficult things. But the thing that they do the worst with is uncertainty, because it's hard to plan. And we have a situation now where every day it seems like we learn something new, often something that contradicts something we thought just a couple days ago. And I think that provides a kind of helplessness and stress to our, not just our frontline workers, but to everybody who's connected in some ways to this disorder that is really unprecedented, at least in my career, and really requires a new way of thinking about how to help people deal with that level of stress and uncertainty.
Great. Thank you both. So, and Dr. Gerber, then a question for you to lead off. What would you describe as sort of the unique barriers for frontline workers and that population in seeking out the sort of emotional and mental health related support that they in all likelihood need right now?
Great. I appreciate that question. And it really, in many ways, comes right out of what Dr. Xenakis and I were just talking about, which is that the culture in the healthcare providers is very much one of knowing, feeling certain, and then doing. And when you put healthcare providers in a situation where we don't know a lot and where there isn't always something to do, or at least the things to do aren't as helpful as we had hoped, you put them in a unique amount of stress. Here's where the barrier comes in, because what the culture of medicine very often says is, if you run into a problem that you don't understand or you don't know what to do, you double down and you work harder and you spend more hours working, or you give even more of yourself. And that's where burnout and negative mental health events start to happen. When the healthcare worker feels that they're not doing enough, and if only they spent more hours awake or read more articles or worked harder and put themselves in more danger, that somehow would solve the problem, as opposed to stepping back and making sure that they were taking care of themselves. There's kind of an old adage in medicine that says that, and this applies not just to doctors, but really to all healthcare professionals, that doctors make the worst patients. And one of the reasons that is because doctors are enculturated. I wouldn't say necessarily trained, because I think most of our training has gotten to the point where we train people to take care of themselves, but the culture remains that people don't take as much care of themselves as they need. So for example, providing doctors with hotlines or saying, oh, you can reach out to such and such a resource, often isn't enough, because the doctors don't think that way, or the healthcare providers. They think, how can I work harder? And it gets harder and harder to get healthcare providers to ask for the help they need, to step back, to take time off, to do things for themselves, even if in the short run, in the long run, that'll be helpful to them, because all they think about is in the short run, that's removing themselves from the team and from the direct care they're providing. That takes a lot of work to counteract that kind of a barrier.
Yeah. So, and to that point, what can the healthcare community itself do to support its members in seeking out those supports and taking those steps back and all of that?
Dr. Xenakis?
Well, let me just add a couple things. First, also, because I think you put it just right, Dr. Gerber, but also for the people on the front lines, that is the nurses, aides, and the police, is the other aspect of this is they don't have the time. I mean, they're really running as hard as they can. And to take time to ask for help means that they have to take time from something else that they think they're also being asked to do that may be more important, take care of patients, or they've got to race back and take care of the families this pandemic goes, and help their kids and support their kids. So this is there's a practical aspect of this that comes to what needs to be provided and set up that really fits with what the rhythm is of these people's lives. And that's very, very difficult for everyone, from the physicians and nurses to the aides, to the police, and even the cleaning staff in the hospitals. So then the second thing is to, I think, build a climate here, and that has to be at all levels of an organization, the values, which is that in order to do a job most effectively, and that is to accomplish the mission. It is as important to take care of oneself, ourselves, as it is to be, in order that we can be most effective in doing what we want to do. And that value gets set into place. And that with that, there's a sense of what are certain self-care tasks and routines that we all need to have, so that we can make sure that we're most effective as professionals, they're most effective as parents, as spouses, partners, whatever we're doing. And that within that being most, and knowing that that routine is set in place, that there are situations where we need to go out and pull aside and say to someone, I think I need some help here. I do need to talk to you because I'm finding that this is really something I don't know how to handle, and I've never faced something before. And that our professional staff understands that there really is a narrow window for that. The usual way we do counseling, which is very effective and has worked extremely well, in this kind of crisis situation, it needs to be adjusted so that it fits into the rhythm and routines of the people who are really out there on the front lines. So there's a lot of adjustments here. There's a lot of principles. There's a lot of knowledge, as Dr. Gerber is saying. There's well-intentioned. There's conscientious way that people go about doing it. But there needs to be some very practical adjustments so people get what they need when they need it. And that's the focus here, that we are working at hard to configure and be able to set up for all the folks that are going to continue working over the coming year. And we see this going on for some time.
Great, thank you. And you sort of started to answer the next question, sort of at one level, but how would you describe sort of best practices, as it were, for frontline workers to be taking care of their sort of mental and emotional health right now?
So I think that the best practices are first for them to know that they have got to put in place in a disciplined way, self-care routines. They need to be almost thinking of themselves as performers or athletes. And in order to be able to perform the best, they need to get sleep. They need to make sure that they've got a good routine, that they've got the relationships and the teaming that with partners or anybody else when it comes to all their other responsibilities, diet, make sure that they, if they're not self-medicating too much or in the wrong ways, and that if worship's part of their life, that they make sure that they are able to keep that going and are getting whatever solace and comfort that they have typically gotten in those situations. And those are the fundamentals for being able to maintain your mental health and your physical health when you're going through the kinds of stresses and crises that these people are now having to manage. And those are the basics. I don't know if Dr. Gerber's got anything to add to that. That's what I see.
I just wanted to share a framework that I bring, which I think really helps me think about all the different things that Dr. Xenakis is putting on the table, which is that with most complex problems, there's not a silver bullet. There's not a single intervention or a single port of entry. That what we're really talking about here is a multi-level approach and framework that helps catch different individuals in different places, depending on where they're most stressed, because that's going to be different in different situations, but also where they're most open to accepting help. And you know, one of the greatest dangers of any approach, it's not just in healthcare, is the old adage about, you know, if you're a hammer, everything looks like a nail. And we as mental health providers are used to providing treatment in certain ways because that's the way our system has evolved. But we don't have time to wait for people to come to us. We need to adapt and then provide this multi-level intervention that is going on the front lines, that is giving people the opportunity to take a break and step back and talk to somebody, maybe not under the guise of mental health treatment, but under the guise of wellness, or just to talk about some problems in the workplace or ways the system is failing them. And then we also need to be able to take it the next step if they do need to take a break and be relieved of some of their duties in order to get help. And even at the level that they're not in the right place at all. And all this has to be done in a way that doesn't feel blaming. Because, you know, I think one of the things that I often remind myself is when we're calling our frontline workers heroes, which we should absolutely be doing, we're maybe accidentally or inadvertently also setting them up. Because we don't generally think of heroes as being in need or wounded or tired or grouchy or angry, right? But in fact, we need to give them the space to not always be heroes, to sometimes be regular people who have needs, and maybe not needs that they're necessarily so proud of all the time. So I think we have to be aware not to put our frontline workers only on a pedestal. Yes, we have to give them enormous thanks and be incredibly grateful for what they're doing, but we also have to be able to accept them as human beings who need help. And I think you know, the program that Dr. Xenakis has outlined and is building really does all that.
I'd like to add something to that, because I think you've brought up a very, very important fundamental here. And that has to do with when people are in crisis and stress, as these people, many of our folks are, in this situation. In fact, they lose the capacity to be adaptive. And just because they're not adapting, we can't blame them. It's about them. It's not about us. And we do have a culture that talks about people being compliant or not compliant, or is prescriptive in terms of our treatments and so forth, for good reason. But we need to understand that when people are in stress, that they may not have a very wide window of what they can do when they're feeling and they most need help. And it's up to us to be adaptive. And the burden is really on us to meet them at where they are and to support them. And that's a shift. That's really a big shift in terms of how we do this extensive program of resilience and support for these people that are out there. And I think that we can do that. And I think we've got the right, you know, attitude about it, but it's just very important for us to keep that in mind.
Great, thank you. So then to address one other piece, because it is a very real phenomenon. We've all heard of cases where there have been some frontline worker suicides during this time. We know specifically that physician suicide rates are higher than the general populations in a normal time. Dr. Gerber, starting with you, could you talk a little bit about how the circumstances right now might exacerbate that trend during this time?
Sure. No, it's such an important question, Susanna, and I think really one we should be talking more about at all times, but I think appropriately comes to the fore with this crisis. So first, to put it in context, we have a massive epidemic of suicide in this country under all circumstances. There are close to 50,000 deaths by suicide in the United States every year. And just to give you a sense of that, that's as if that, that comes down to about 10 people committing suicide every hour, if you count, waking hours, let's say about 12 hours a day or a little more. So it's almost mind-boggling to think how many people are dying every year. And this didn't just start this year or last year. This has been going on and gradually increasing for some time. And there are many causes of suicide, but this is an area of very active study, and these rates have not been dropping. These rates, despite all the scholarship and improvement in the way we treat mental health in this country, have been rising rather than falling. So now, if we move from that into the question of physicians in particular, it's been known for some time that the rates of suicide among physicians are higher than in the general population, and for reasons that we don't fully understand, are different in men and women. So the last major meta-analysis that I know of, that is a study that looked at a lot of different studies altogether, was done about 15 years ago, and it showed that the suicide rate in men is about 40% higher in physicians than in similarly aged men. In women, it's 140%. In other words, it is over twice as high in female physicians as it is in women in general. So you really have a massive problem of suicide. Now, of course, the number of doctors in our population is still relatively small. So the total number of suicides per year of physicians is about 300, which may not come on our radar the same way 50,000 does, appropriately, but still 300 physician suicides a year is much more than one would expect just in the general population. Now we start to ask the question of why, and clearly there's a lot of components to this. So one component is certainly around stress and the ways in which, and perhaps this is part of why you see such a difference between men and women, that women in our culture are asked to take on so many more roles simultaneously. So the physician, a woman may be expected by our culture to also be a fantastic mother and also be a fantastic wife and an academic and a provider. And maybe men are under a little bit less of that stress, but nonetheless, physicians in general face that kind of stress. And now you add this current pandemic, and one can only speculate that these rates will go still higher. Unfortunately, there's not a lot of research about this. So that, as I mentioned, the last major study was 15 years ago. We should be studying this much more frequently, and we should certainly be studying it around the pandemic itself. Because if we're going to get our hands around the problem, that's a necessary first step in order to try to make interventions and to decrease that level of morbidity and ultimately mortality. But I know Dr. Xenakis has had responsibility for many doctors in the military, and I'm sure has something to add to that.
Well, I think you've summarized as well the facts and the sciences of what we know. And I have had my experience as a military doctor, where in fact, unfortunately, with this Iraq-Afghanistan war, we've had a rising number of suicides amongst our soldiers. And we know that in the other work that we also have about 22 suicides a day amongst our veterans. My experience is, and I'm worried about that the frontline, the healthcare people, the doctors, the nurses, the aides, a number of folks will in fact be so overwhelmed and have been so deeply affected by what they've seen when they've been involved in trying to treat these patients, and particularly in situations where many of them die. We were just hearing not long a couple hours ago of the number of deaths in ICUs in some of the hospitals there in Connecticut, and as well as in emergency departments. that this lingers in the lives of these professionals, of these men and women. There are, yes, as Dr. Gerber says, there are many factors that probably we need to study to figure it out. What I want to really I feel is important to put time and energy is to catch these people, to be aware, to be attentive, for our eyes and ears to be open, and to know when they're showing the signs that this has been too much for them and they don't see a way out. I have treated a number of soldiers over the years who made very serious suicide attempts and just by luck lived through them, and have come in and they would say to me, "Sir, I was in such a black hole, I saw no light. I couldn't see anywhere that I could make a life." And I think that happens. I think that's the most poignant statement. And I think what we need to be able to do is alert all of us, particularly those of us in the healthcare profession, that in fact, that is what happens. And particularly since we are trained and expected to take care of everybody, no matter what, no matter how hard it is, in our way to be heroes, that there are times when in fact it just is overwhelming. And the only thing we can do is also be sensitive and thoughtful and listen to each other and catch someone when they're close to that, and hopefully lend the hand that keeps them from killing themselves.
Thank you so much. So as we've talked about, we're building the COVID resilience team at Silver Hill to help respond to and hopefully mitigate these effects that are out there. For both doctors, what other programs are you aware of that are available to, whether it's the pandemic, whether it's other crisis type situations that are out there to support frontline workers?
I can start with that. So it's an excellent question, and I think to the credit of our colleagues in other settings, there have been a number of efforts to build systems. I think it's been challenging because these systems are focusing on so many different stressors all at the same time. But to give you one example, at Yale University, which is not far from us and with whom we're affiliated, we have both in the adult and in the child psychiatry departments some efforts to learn from past traumas or disasters on building services. So for example, not that long ago was the very tragic events of the Sandy Hook shooting here in Connecticut. And not long before that, the tragedy of Hurricane Sandy and 9/11 and other disasters that called upon our mental health establishment to build teams. And so the work of Stephen Southwick, who works closely with the Veterans Administration, as well as Steve Marins in the Yale Child Study Center, really focused on bringing resources to the front lines and really training. It's very much this idea of the train-the-trainer model that Dr. Zanakis spoke about earlier. And they have training programs for teachers and for police and for other individuals to get this out there, along with very kind of digestible handouts and so that everybody can become an expert. These approaches, have different content to them, but if I could summarize one common element that I see in all of them is very much this notion of building teams. And you might even think of it as, in a way, an important counterposition to the notion of the individual hero. In American culture, in contemporary culture, we're very fond of identifying the individual as the hero and thinking of that person who then saves the day or fights off the villains single-handedly or scores the winning goal. And we can all imagine and think of ways that we want to be a hero. But in crises like this, it's far more important to have a team of people that does not rely completely on one or even a few individuals, but can rotate in those people so that people are rested. And that way, nobody has to feel bad about saying, I'm going to sit on the bench for a while, or I'm going to go take a water break, or I'm going to go sleep, while my teammates are carrying the ball forward. And I'm going to come back when I'm rested so that I can give relief to the next guy or woman. And that kind of team culture is taught in all these different interventions and is a core component of our COVID resilience team as well.
Great. All right. Well, it's about 20 to 1, so I think we would like to open it up now to Q&A. If anybody has questions, you can submit them there's an option to submit questions there, and we can feed those to the good doctors. And I'd also like to mention now, anybody who is attending, we sent this invitation out widely, hoping to reach a large number of people, and we hope that we can stay in touch with you, those who did attend today. If you'd like to leave your contact information and name in the chat section, we can follow up with you. This is being recorded. It will be on our website, but we can also send out links. So please do share your contact information as well.
I'd like to ask a question of Dr. Xenakis, if I could. I'm interested from your experience, Dr. Xenakis, in the military or in military health providers. How do you help convince somebody who may be, first in his class at West Point or used to being the hero to work as part of a team and accept his or her own frailties, as opposed to always think of him or herself as having to be perfect at everything? How do you do that?
Well, that's a great question, Dr. Gerber. So that is fundamental to Army leadership and particularly the combat arms. So it starts from even the cadet years. For those first years that go to West Point or the first years in ROTC, that in joining the military, there's a sense that it's all part of a team. And all training has that orientation. People think, for example, I think one of the most vivid has to do with Ranger School, which is this pinnacle of training and toughness and thinking about the person who's so strong and getting through it. But the lesson learned is that it's about team leadership, and people get through Ranger School and all the hardships and obstacles that it has because they get through it as a team. And that the military's effectiveness in operations is as a team, all the way up to the point to the most senior leadership. So now there's the challenge comes in healthcare, because we, particularly as physicians, are not necessarily trained or oriented to be thinking of ourselves as members of a team, right? We're individuals. We're individual practitioners as psychiatrists or internists or cardiologists or radiologists, or even as surgeons in the ER, even though we're leading a team at times for doing that. But we're not necessarily linked and teamed with our other providers at our level. And what we did in the military, first we had to recognize that that's not the part of the way that we educate and train our doctors. The nurses do that much better actually, because they know that they're part of a team and that they're supporting a bigger team in terms of taking care of the patients. And then all the other staff that are also supporting that is to then talk to these doctors, military doctors, and explain to them, this is what's important. What we're going to be doing here in this mission, if we're going to, let's say, set up a hospital in Iraq, Afghanistan, or a hospital in West Africa because of Ebola, we're doing this as a team, and we have to work as a team. And we're going to take lessons learned from our fellow soldiers in the combat arena and apply them to our work as healthcare providers. And we then we systematically put in a curriculum that prepares people to do that, and systems that support that.
It's great, Dr. Snyder. I just had a quick thing to add procedurally. So we're getting used to this new system, and by accident we had the Q&A was closed before, so people weren't able to publish, but someone reached out, a terrific old colleague reached out back channel to let me know. So we've now opened it, and the first question just came in. So hopefully if anybody else has questions, you can try again, and you'll be able to get it in now. Okay, so
that first question that came in for everyone, would each of the doctors be willing to say, let's see, I'm just interpreting, sort of what could be said, frontline workers, what could be said to that frontline worker who may need help and may need to seek that?
So my first thought is very much along the lines of what Dr. Nazakis was just saying, which is to go back to this notion of the strength of what you do is working as part of a team, and to really emphasize that this battle is too large for anybody to fight on their own, and the only way that it's going to be won it is by working together. So what I would sort of, you try to speak to people's desire to help. You say the best thing you can do to support the patients is to work as part of a team and to show all the other people, all the other doctors, all the other frontline workers, that they too can ask for help. So you might even say this to one of the leaders and say, look, by you as the leader of this team saying, raising your hand and saying, I need help sometimes, you're going to make it okay for the rest of your team to do the same. And that kind of gets the message across that this is actually part of what they as leaders and as frontline workers need to model for everybody.
I can't agree with that more. I mean, and so that the frontline leaders understand it, and that it's they are reaching out literally to all their people and say, look, we're all in this together. We're all feeling. You may think that you've got something different and you are stressed in a way, but we're all stressed under this thing. It may leak out differently for each of us, and there needs to be a special chemistry and commitment, being able to literally look those people in the eye and put a hand on their shoulder and say, hey, look, let's take a moment and let's regroup, and we'll do it together. Because look, this is really bearing down on all of us. It's a shared experience.
Great. So the next question, and I'll sort of answer it generally and then send it to the doctors. But can you please point us to resources you have found valuable for resilience building? And before we finish today, I will give everyone my email address, and so if there are follow-up questions and resources are needed, you can email me and I can sort of get those to the appropriate people at Silver Hill. So that's a very general answer, but then specifically, are there resources, Drs. Gerber and Zanakis, that you would point people toward?
Well, I'd like to just start with that because we've got a great team with Tara Reid, Amy Jadd, Cheryl Bundy, Georgia Nagel, a number of folks who are really compiling all those resources to be formatted in a way that they are useful to people on the front lines, but also have all the background information. There's much material, as Dr. Gerber was saying, that has been published by the Veterans Administration and in collaboration with Yale and a number of other hospitals, by the military through the Uniformed Services University of Health Sciences. Those are all resources that are out there that are being used and provided across the country. We've extracted from those, excerpted from those in ways to format them and building a library that would be useful to people in those direct face-to-face contacts in the various settings where they're seeing these patients. So there's a lot out there, and we're hoping to make it very, very useful and practical to folks in the course of their work.
Great. And I'm
one of the challenges, if I could just say, is that there's so much out there that one can get a little bit lost. But I wanted to echo one of the recommendations Dr. Zanakis made. A website I have found extremely helpful in organizing is the Center for the Study of Traumatic Stress, which comes out of the Uniformed Services University. And we can send it out later, but it is cstsonline.org. CSTSonline, all one word, .org is the Center for Study of Traumatic Stress. And they have some really wonderful materials, some of which we've incorporated into our work. Great.
And I've just put my email address in the live Q&A section so for any additional questions that come up after this. Let's